a bit more appropriate for the current landscape. Next slide, please. Okay. In terms of funding, I've included this figure because I think it just really shows the leap in funding from 10, 15 years ago until today. So if you look at the spend in 2006, 2007, it's jumped up 92% to 2021, which is just a miraculous figure. And I think it just goes to show you how much more mental health is being recognised as an issue across our health and social care systems. We've also got the funding that's attached to the Transition and Recovery Plan, and that's backed by additional investment of 120 million recurring funding each year. If there's any NHS people on the call as well, you know that funding this year is a bit of a different beast, but we'll just breeze past that onto the next slide. Okay, as I said before, the spectrum of mental health is really vast and wide, and it goes from that prevention space right through to specialist care. So in terms of prevention and wellbeing, there's quite a lot ongoing in government. This includes, during the pandemic, initiatives like Clear Your Head campaign. I'm sure everyone heard of that at the time. It was a really successful campaign and website launched during the pandemic to support people's mental health and wellbeing needs. It's recently been replaced by this Mind to Mind website, which is now going to showcase sort of advice with people with lived experience of mental health and wellbeing challenges. It's been developed in phases. So phase 1's live at the moment. Phase 2 is in development, but that's going to probably involve a bit of engagement with third sector and other areas so that we can pull out people's experiences from a wide range of groups. Next slide, please, Jo. Okay, another initiative in the sort of primary prevention community care is the Community Mental Health and Wellbeing Fund. Now, I'm talking about this specifically for adults. There is a children and young people one as well. So you'll see that there's quite a lot of investment over the last couple of years from this fund. And this fund was created specifically to support priority groups during the pandemic, and that included women, particularly young women and women and children affected by gender-based violence. So this actually funds a range of initiatives across Scotland. I've pulled out one of the kind of key ones for us, which is in Edinburgh Women's Aid, so that they're receiving funding from this fund to develop a specialist role in mental health, and that's to aim to support their overall recovery of women and children affected by domestic abuse. These are the kind of initiatives that I think we can probably learn from today and work out what works well and what success looks like in this space. Next slide, please. Okay, to take a jump through to kind of your secondary care on that spectrum. So at the moment, the Scottish Government's actually developing standards for adult secondary mental health care services. This is something that when I joined the Mental Health Directorate, I was quite surprised it didn't already exist. So the whole point in this is to sort of streamline care and reduce the scope of unwanted variation in care. And it's therefore to reduce inequality in experience and outcomes for service users. So we're hoping that these standards will be measurable and that they'll provide us with a mechanism to scrutinise how well services are performing as well. A range of partners have input into those, including different equalities groups, and it's got governance mechanisms in the form of a quality and safety board that's chaired by our minister. So the draft standards will shortly be ready for consultation, and they'll be shared in the next few weeks or early into next year. And I would encourage anyone in this call to have a look at that consultation and input from your perspective. I think that would be really important. Next slide, please. Okay, so the suicide prevention strategy was published in September, and it outlines how the government partners and local communities can come together to prevent future suicides. So this is a long-term strategy, and its aim is to bring about a step change in suicide prevention. It's underpinned by a dynamic action plan, and there's a bit of funding attached to that there as well. Next slide, please. I'm just going to pass over to Nadia for this one. She's going to take you through the mental health and wellbeing strategy. Nadia?
Thanks, Kirstin. So my name's Nadia Hussain and I'm based in the Mental Health Strategy and Coordination Unit. As Kirstin mentioned earlier in the presentation, we are currently in the process of developing a new mental health and wellbeing strategy. And this is going to be building on the implementation of the Mental Health COVID Transition and Recovery Plan. So in terms of the ways that this new strategy is different from what we've done in the past, is that the scope of it is going to be much wider than our previous work in this space, with an increasing focus on wellbeing and prevention, as well as early intervention. And we're also going to consider how the strategy can take account of social factors and inequalities that may impact a person's mental health and wellbeing. Can we go on to the next slide, please? So we consulted on the mental health and wellbeing strategy earlier in the summer. This consultation opened on the 29th of June and closed on the 9th of September. And it asked a range of questions covering the definitions of the language we use when talking about mental health and wellbeing, our vision, areas of focus, and our outcomes framework, people's experiences, including what factors impact their own mental health and wellbeing and their experiences of mental health services, and also a range of questions about the mental health and wellbeing workforce. So we're now in the process of having the responses to this consultation independently analysed, and we're using the findings from this analysis, as well as the information we've gathered through wider stakeholder engagement, to inform our first draft strategy. And I'd like to use this session today as an opportunity to give you a bit of a flavour of what that draft strategy is going to look like, what our current vision and outcomes are going to look like, and how we foresee the final version looking. Can we go on to the next slide, please? So one of the things we consulted on was our vision for the strategy. So we'd initially included our vision as better mental health and wellbeing for all. Through our consultation, 75% of respondents agreed with this vision. However, some people did think it should be more aspirational and show the importance of stigma, resilience, and overcoming challenges. So we had particularly strong feedback from the Diverse Experiences Advisory Panel on this as well. So I've popped our current draft vision on the screen, which is now a Scotland free from stigma and inequality, where every person experiences and has the right to achieve the best mental health and wellbeing possible. And we would welcome any thoughts or comments anybody has on that current draft vision. Can we go on to the next slide, please? So we consulted on a range of draft outcomes for our strategy, and the majority of people that responded, 80 to 90% of people, agreed strongly with each of the outcomes that we put forward. However, we did receive a lot of feedback that there was a lot of outcomes and that they needed to be a bit more smart, and we wanted to refine the outcomes based on that feedback while retaining the essence of what we'd put out there and what people had asked for. So our proposal is that we're setting a series of high-level, overarching long-term outcomes with a more detailed framework sitting behind that, which we're going to be looking to present as a logic model. So on the screen, you can see some of our, I think there's 2 slides showing what our current overarching outcomes framework is. So I'll just go through them really quickly. At a population level, we'll be aiming to have the overall mental health and wellbeing of the population is increased and mental health inequalities are reduced. For individuals, we'll be looking for more people with mental health conditions, including those with coexisting health conditions, experience improved quality and length of life free from stigma and discrimination, and more people have an increased understanding of mental health and wellbeing and can access appropriate support. For communities, we're looking for communities that are equipped to act as a source of support for people's mental health and wellbeing, championing the eradication of stigma and providing a range of opportunities to connect with others. In terms of societal influences, we're looking that through a range of cross-policy actions, we have worked to tackle the wide-ranging social, economic and environmental factors that impact people's mental health and well-being, including poverty, discrimination and injustice. Can we go to the next slide, please? Just the last few overarching outcomes. We've got one on the mental health and wellbeing workforce. So the future mental health and wellbeing workforce is skilled, supported and sustainable. We've got a couple for services and support. Comprehensive services that promote and support people's mental health and wellbeing are available in a way that meets and respects individual needs, and that the design of services is better informed by people with lived experience of mental health issues and practitioners with a focus on recovery. Lastly, we're really keen to have improved data and evidence in this space. So we're looking for decision makers and practitioners to have better access to improved evidence, research and data to better inform policies and approaches to mental health and wellbeing. We go to the next slide, please. This slide sets out some of our draft guiding principles that we've put together based on the feedback we've had so far. So these principles should guide all the work that we do under the strategy. So we have our draft vision outcomes and we're starting to think about how to achieve those. In order to do that, we first need to know what the evidence is telling us about current mental health needs in Scotland and the challenges that we need to overcome. So our guiding principles, we've got that we want to be evidence-based and informed by lived experience, founded on equality and human rights, trauma-informed, outcomes-focused, developed and delivered in partnership, and having a no wrong door approach. Can we go to the next slide, please? So I've outlined some of the key challenges, and this is sort of the issues that we're looking at that we think that the strategy needs to consider and that we need to address. So global health, economic and political challenges. That's looking at things like recovered from the COVID pandemic and the cost of living crisis. Looking at stigma as well and supporting those with multiple and more complex needs, including trauma and severe and enduring mental illness. We understand that there's a current increased demand for mental health care and treatment, placing unsustainable pressure on services, and delivering mental health services also needs the right workforce with the right skills in the right place at the right time. And one of our other challenges is the current lack of data and evidence around mental health in Scotland. In terms of how we achieve our vision and outcomes, we're looking at doing a 3 Ps framework, as we're calling it, which is looking at promote, prevent and provide. So these were actually developed from a proposal from Scotland's Mental Health Partnership, and we're aware that a lot of other organisations use this framework as well, although there may be some differences in how we define them. So we're looking at setting it out under promote, which will be promote positive mental health and wellbeing, preventing, which will be preventing mental health issues occurring where possible and tackling underlying causes and inequalities, and providing mental health and wellbeing support and care and ensuring people can access the right support at the right place at the right time. Can we go to the next slide, please? Just a final point for me, this is what our proposed structure of the strategy is going to look like. This is all very much still draft, and we'll be looking to get feedback from stakeholders over the coming weeks and months. But we're looking to have a section on mental health needs and challenges in Scotland, our vision, our definitions and scope, our guiding principles, our outcomes and our 3 Ps, a section on transforming mental health services, a section on workforce, and a section on interdependent strategies and policy drivers, which will take that cross-government view into consideration as well. And I think that's my last slide. So thanks, everyone.